Hi, back with another video. This is year 3 post-transplant. It's been a while, I know. It's a lot of what's going on. Wasn't looking too good. But you know, here we are. So jumping from my last video, so I got the meds for the rejection, right? So the IV was in. I don't know how we did the IV. I think it was at the hospital or the ER or something like that. I don't know. So I have my IV and the IV is in. 6 hours later, the IV is out. The IV is superficial. It doesn't, I don't know, it came out super easily, like, you know, with just like a very small tug. So, I mean, which was okay. It was only for 3 days anyway, so it is what it is. So I called my nurse and I'm like, oh my God, the IV's out. What are we gonna do? She's like, okay, don't worry. You need to just go back to the hospital. I was like, no, it's all right. Do you know how to put IVs in? Because I'm not gonna mess around with these people. So she's like, okay, I'm gonna come and try to do it, but you probably have to go to the emergency room. I was like, so she's like, you know, to be honest, I can do it. Let me try to do it. So she does it. She tries it like twice and she doesn't get anything. So she's like, listen, baby, I got something for you, okay? I'm gonna call up my friend. He works in the ER. That's all he does. He puts lines in. He's RN and he's amazing. I'm like, all right, okay, go ahead. You can call your friend. So her friend comes, you know, he's like in his scrubs, like it's lunchtime. Like he's like, listen, we're gonna do this right now. So he comes and he tries, right? If I said that he probably booked me about 30 times, if I counted, I wouldn't be surprised. It had to be more, about 20 times. So he's like, oh my God, I know that this is really hurting. Don't worry, I'm gonna keep trying to get something. And I'm like, you're good. Like, I lost feeling in my arm like 30 minutes ago. So at this point, you can just keep going. They're both swollen anyways. Just keep doing what you're doing. Because technically it's the nurse's responsibility, the nurse that came to my house, to restart the line, basically, is what they told her. So she's egging him on. She's like, yeah, keep going. And he's just going, you know, he's just going. And then I don't even say anything because I'm just like, I'm speechless. I'm like, he's still going. Like, he's still trying to find a vein here. So he has to give up. Can't find a vein. At this point, both my arms are swollen. I'm just like, okay, you know what? Let's let the swelling go down, and then I'm gonna call my transplant team. Call my transplant team. She's like, I can't do anything for you. You live in Florida, right? They're in North Carolina, so we can't do anything for you from here. So you're gonna have to figure it out. You're gonna have to find somebody to put it for you. So end up having to go off script, go onto Google, and start calling nursing companies, asking them if they know how to find people. If they have people that know how to do lines. And finally, I find some guy that can come in and he puts in a midline for me, right? So, but regardless of that, by the time the guy can come, and by the time I've gone and tried to call all my doctors and all my specialists, and everybody's like, oh, I can't help you. I don't know what to do. Oh, you're in Florida, or, oh, I don't know. Maybe you need to go to the center in Kendall. The last time I went to the center in Kendall, okay, they were supposed to put in a PICC line. And I kid you not, they didn't put it inside a vein. And as soon as the nurse flushed some saline in there, I passed out. And they had to call the ambulance for me. So there was no way I'm going back over there. I'm like, listen, Gucci, I'm like, you know, I'm gonna do what I have to do. So I call around, and then finally I find a company that comes and does it for me. So like I said, I missed like 2 or 3 days of medication. I had the first day, and then 2-3 days later, I had the other 2 days. But by then, my transplant coordinator is like, oh my God, it's been so long. I'm going to ask the doctor if we should just restart. So they decide to restart the steroids again. So I had 1 day, skipped a couple of days, then I had to have the whole thing all over done. I mean, start the whole 3 days over. But what I mainly noticed after this is that's when I really start noticing I'm having like my kidney numbers are different. Like my numbers are not the same after this. So, so that's when we start to notice this problem, right? So they're like, you need to go see a hematologist, you need to see a kidney specialist. You know, you're in Miami, you need to see somebody there, because they're like, oh, you know, we can't help you if there's something wrong, right? So I start seeing this office. It takes forever to get an appointment. Meet with her. She's like, you know what we need to do? We need to get in there. We need to see what's going on. Let's do a biopsy. I called my transplant doctor back in North Carolina. I'm like, sir, you don't need to do a biopsy because you already know that it's the program. Well, he's like, well, you never know. I'm like, yeah, but it's ghetto here, sir. This is not normal. You think that this is normal healthcare? It's odd, okay? But he's like, oh no, let them do it. They might find something that may be able to help you. Me, I'm like, I already know what it is, because the doctor is convinced. She's like, oh, we could probably find out something that could really help you with your kidney issues because they run in your family, right? And I'm like, nobody in my family has kidney issues. Like, this started to happen because of the immunosuppressants, because the dosage is high. And she's like, are you sure? Like, think, you're a woman of color. Think of your grandpa. I'm like, nobody has that. So, so they decide that they want to do that. Now, by this time, they've already, put the appointment, and I have to wait. I have to wait probably a month or so. But I also tell my coordinator, I'm like, hey, feeling kind of down lately, not feeling, good. And she's like, well, what's wrong? And I'm like, she's like, you just had your transplant, you got to give your body time to heal. I'm like, well, I'm like sleeping 18 hours a day. Like, I can barely stay awake for 6 hours a day. Like, I am sleeping constantly. Like, I have a conversation, I go to sleep. I drink some water, I go back to sleep. Like, I'm not able to function as a regular person. And she's like, well, it sounds like you just need your rest, you just need to relax. I'm like, miss, it's been a minute. It's been a year. I don't think this is normal. So she's like, okay, I'm gonna ask the doctor about it. So she asked the doctor about it. And by this time, the rejection meds are done. They've already done that. And she's like, well, it could be, I told her, I was like, ever since we had that extra day that you gave me where you guys started all over, it's been off. And so she's like, okay, well, I'm gonna let them know. So meanwhile, I'm taking endless cat naps. I'm sleeping nonstop. And so she calls me back. She's like, Ruth, I just heard back from the doctor. How are you feeling? You feeling better? I'm like, no, I told you. At this point, coffee has no effect. And she's like, you know what? I think it's your kidneys. I think the doctor thinks you need to go to the ER. I think that your kidneys are going down. I was like, oh, okay. Very good. All right, so go ahead. We head over, and they're like, well, let's wait for the biopsy. So they go ahead and do the biopsy. Doctor comes in. He's excited. He's like, hey, I've never lost a patient, right? I've never had a patient bleed out on me before. Like, my patients always come out 100% alive. Like, I know what I'm doing. And I'm like, I mean, it's a kidney biopsy. Why is he telling me this? Like, this is standard, right? Like, people get kidney biopsies. Like, and I was against it because I was like, I already know it's the Prograf. I already know it's the immuno. I already know it's Tecamodis, right? So, but they are determined to figure out what the problem is. And by they, I mean the doctors in Miami, right? They really want to know. So they're like, you're young. It doesn't make sense that these transplant meds would be having this much effect on your health. I was like, you don't know my health like I know my health, okay? I'm telling you. So, so they do the biopsy, and they did not tell me that I need to be on bed rest. I didn't know. I hadn't looked it up because I was just like, it's a biopsy. I have lung biopsies all the time. Take a nap, wake up. They give you the results in a couple of days. I didn't know kidney biopsies were they had all this stuff going on. So I'm like, okay. So they're like, you need to be on bed rest. Me not knowing anything, because the guy that made the appointment didn't tell me anything either. My husband's out of town. He's working. And now I have to go stay at my parents because I'm not supposed to be walking around. So it's been maybe 3-4 days, and I wake up with this severe pain on my right side. And I'm like, what's going on? I don't know what's going on. And then my dad's like, okay, you need to, it's like 3-4 in the morning. My dad's like, okay, you got to go to the hospital. I was like, let's wait. Let me get some Tylenol. Take the Tylenol. About 2-3 hours later, so, I'm crying. I'm like, Jesus, help me. He's like, okay, so now you're screaming, so now you need to go to the emergency room. So he forces me to go. So he basically has to pick me up him and my mom try to force me to go to the emergency room. I'm like, no, I'm good. Like, you know, just like if I pass out, that's when you call them in North Carolina. Don't call anybody from here. So they're like, no, we're not going to do this with you because you never want to go to the hospital. So I had already been hospitalized with kidney issues 2 or 3 times, like 2 weeks or 3 weeks after my transplant, I had to be hospitalized. And then again, you know, for the longest I had been there for like probably 2 weeks. I had been hospitalized twice in North Carolina and probably once in Miami for the same kind of issue, you know, where, you know, they had to keep me and give me meds and things like that. So to me, I'm just like, you know, we already been going down this road. We know what the cause is. So when I get there, Dr. Superman is not there, but they let me know that I indeed was bleeding out. So they had to take me quickly to go do a procedure to get it closed up, yada, yada. So they do that. And so they say they're going to keep me overnight just to keep me under observation. I'm like, okay, I guess, you know. So they keep me, and the next day the doctor comes in. He's like, well, we did some more labs overnight, if you noticed. I'm like, yeah, I noticed that you guys woke me up about 4 times. And so we're going to keep you for another day and keep watching this. So the day turns into like an extra 4 days. And at this point now they've cut off all liquids and they have me on a special diet and on a special kidney diet. So he's like, it's not looking too good, Ruth. I need to talk to you about, have you ever thought about maybe getting dialysis? I was like, for who? He's like, you're gonna need it because your blood levels are so toxic right now. And I'm pretty sure even as you're talking to me right now, you're probably not feeling good. I'm like, no, I feel good. I did it, but I just wanted to go home, right? So he's like, yeah, so they keep coming. And then even my regular doctor, the lady that was extra curious about whatever was going on in my kidneys, she's coming. She's like, oh, listen, you know, the program is really nice. All the nurses are great. Everybody's great friends. You get to come to the office if you want. You could do it at home. It's so easy. It's so simple. All the kids are doing it. I'm like, no. So she keeps giving me the pamphlet. I keep throwing the pamphlet away. I'm not reading it. I just keep doing it. I'm like, I'm not doing that. No. And she's like, well, you can keep you on dialysis for now, and then just get you on the transplant list for a new kidney. I'm like, I just did something. Like, I don't want to do that. Of course, obviously, you know, being a difficult patient, right? Because if you need it, then you need it. So I'm telling God, I'm like, God, listen, I just had a transplant. I don't want to do another one. And I am going to complain about this. I'm not going to take this silently. A lot of stuff be happening. This right here, this I'm not okay with. I don't want to do another transplant. My life is already complicated. It could get way more complicated, but I like to keep it the way that it is. I'm just trying to keep balance of everything that's going on right now. I just want to kind of get over this first hurdle, these first 16 hurdles. I'm just trying to, you know. So she's not having it. She's like, yeah, you're going to do this. Meanwhile, I haven't told anybody anything. I didn't tell my friends. I didn't tell my family. I didn't tell anybody anything. She keeps talking to me, bringing up dialysis. I make sure that whenever, luckily she comes early in the morning, so nobody's here to hear about all of this because this is like, it's like, no. So, and you know what? I'm going to be honest. I know as Christians, we're not supposed to be angry at God. And who am I? A little tiny ant, peasant, to be angry at God. But I had already been mad at God for several years already. For several years. So, you know, like, I don't know, I was just mad because I was like, I felt like I had been doing everything right. And I had been taking all my medications. I was exercising. I was drinking so much water. I was on top of everything that I need to be on top of. I was on top of. Like, I was my regular CF nurse self, whatever. I was like on top of everything. So, you know, I was just irritated because I was just like, you know, I've done all this, God. What more do you want from me? You know, and obviously there's way worse problems than this. But for me, I'm a crybaby. I'm like, I don't want to do this, no. So, you know, I'm just upset. So, and at this point, I'm having still the depression thing with the medications, and also just in general, I'm feeling bad. I have really bad survivor's guilt because I'm like, okay, somebody died for me to be here. Like, for me, I was just like, I felt like somebody was sacrificed for me to be here, and I just feel like as if I'm like not worth it, like as if, they didn't deserve to have to, end up that way so I could have more time. You know what I mean? So that's not a way to think about it, but you're just like I'm here because somebody else is not. And that just like really weighed really heavily upon me. And then on top of that, I didn't tell anybody. So I'm like, okay, great. So I'm already depressed. I'm already sitting in the dark in the hospital room. The shades are never open. The light is always off. The doctors are always like, oh, I'm just stumbling around in here. Like, it's not going very well. Now these people are on me about this dialysis thing, whatever. So, at this point, I'm in like a deep depression. My only friend at this point is Netflix. Like, I'm not even eating. I'm not drinking. I'm not, I don't know. I'm just here, right? I'm not doing anything. So, and I'm angry. I tell God, I'm like, you know what, God? If you're going to kill me, then just kill me. Because I've already been through all of this already. I've already been through something similar. So why are you making my family go through more stuff? Like, you know what I mean? Like, if it's supposed to end, let's not draw it out, right? Because like for some reason, I feel like I'm Moses. Like, I feel like I can tell God what to do. Like, I'm the boss of something, right? So silly old me. So I'm there for about 2 weeks or so. And then it's like April 2021, May 2021. I'm like, all right, you guys aren't doing anything. I'm thirsty. I can't get no water. Okay, my patience is here. Okay, it's time to go. That's what I told her. I was like, it's time to go. She's like, oh no, the numbers look really bad. So I call up my dad. I'm like, hey, and I'll call up my sister, whoever's coming to visit. I'm like, hey, bring extra water when you come here. So I had the water from the nurses, and I'm just drinking. I'm drinking because I'm like, you know what? Maybe if I just drink a lot of fluids, it might work. And if it doesn't, then it didn't. But I'm pretty sure it's going to work. Me feeling that I have a PhD, I'm like, I'm going to drink water. I'm going to be made whole. So I do that. So start drinking a bunch of water. Next day, they're like, oh, it looks a little bit better. I'm like, all right, I'm ready to go. Go ahead and check me out. Because it's like, yeah, it was like, it's time to go. It's like summer. I just want to be like out, living my life. So, so then I end up leaving, and against medical advice, I'm like, I don't care, I have water at home, like, it's getting better. That's all I need to know. I prayed about it. He's gonna make it better, and that's that. So what made me so angry, I think, was the fact that, okay, we all know that this is not good, but this is just human nature. So I'm just boiling with jealousy of my sister. I have a younger sister who also has CF. There's this miracle drug for CF patients called Trikafta. And they say miracle drug because it has helped a lot of people. Not everyone, but a lot of people. And so what it does is it really helps the symptoms that cause cystic fibrosis, so that you never end up really getting to the point where you get so sick in the first place, or need a transplant or crazy medical interventions in the first place. So I have my transplant in March 2020, and then in December 2020, that's when Trikafta is available. She starts taking it. She's feeling great, right? So I'm just mad because I'm like, well, God, why did God allow me to go through the transplant, or for this person to pass away, when really he could have probably said, me feeling like I'm super wise, like I know what I'm talking about, because I don't, right? So, I'm mad. I'm like, oh, I'm not mad at her, but I'm like super excited for her. I'm like, wow, this is great. You're not going to be sick. You're not going to have to worry about that. That's excellent. So, I'm like, wow, let me color coordinate your pills, super cute, whatever, the little box. And I'm just seething. I'm just mad because now these doctors are super knife happy over here, and they want to change out my kidneys. And I already said I don't want them to do anything over here. So, you know, it's just honesty. And, you know, I've had to learn to live past that and just be like, hey, you know, your life is not normal. Suck it up. It is what it is. You can't compare yourself to other people. It is what it is. So, you know, so I have to keep up this thing, because I'm like, I want to keep the same kidneys I already had. I already had to change out my lungs, right? So, you know, I start looking online and stuff, asking the doctor what I can do. And they're like, you know, and I'm kind of like, I'm a foodie, but I'm also like a little bit of I like, you know, nutrition and stuff like that, like a little bit of a health nut, a little bit. So I just start looking up, you know, kidney friendly foods and things like that. And eventually, slowly, I start cutting meat out of my diet. I already wasn't really eating dairy or drinking dairy, because I had already kind of given that up a couple of years ago, since, you know, dairy causes inflammation and can create extra, you know, like a lot of extra issues in your body. And I was like, my body's already doing enough work. It doesn't need to be doing more stuff because I'm drinking cow's milk, right? So eventually I start cutting that out, and I notice my numbers keep getting better and better. So that's how I end up kind of eating vegan, but not being vegan, because being vegan, that's like a whole lifestyle. I'm eating vegan, you know, as close to it as possible. Maybe like 70, 30, 80, 20 most of the time. As you can see now, my face is blush. You can see that I have not stuck to it. But for the most part, you know, I have tried to regulate that. So if you are having issues with your kidneys, that's something that's worth trying. You know, asking your doctor, your medical professional, to see if it would be the right thing for you. I sound like a commercial, but you know what I'm getting at, right? So I just started eating more plant-based stuff, a lot less processed foods and things like that. And I noticed my numbers were getting better. And a couple months down the line, kidneys were doing good at 27%. Oof, that doesn't sound good. It's better than what it was. It's better than what it was. So, you know, now the doctor's like, okay, you're stable, so we're gonna leave you alone for a bit. I'm like, thank God, right? So, yeah, just something to think about. See if it works out.